Hi guys, welcome to another e-newsletter for this week. And as always, just to start with a massive thank you to everyone on the front line going out there and delivering really high quality care every day. And also a big shout out to you who were working over Easter, working over the bank holiday. Thanks for all the work you put in there. It was really good and we got some really amazing feedback. So thanks a lot for that. So just to start with just a few shout outs really, just to say thanks to some people in the field have had really good feedback about, and to be honest, I've been getting good feedback about loads of people lately. There's been some really, really good stuff. Some people come to mind. I've got Sharon Duffy and Amanda Hind, who got amazing feedback from a number of fellow health professionals. Brianna Devi, Till Prescott, Michelle Murphy, Precious, Trevor Beppy, um, Sam Jarvis, Sarah Corner, Amy Bourne. Lots of really good feedback this week, and I'm really proud that we have such a team at Caring Connections. And I know it's not easy, and I know we face constant challenges daily. We are a charity, as I continuously, say a lot, but even being a charity, there's certain things that we just need to do and run effectively as a business. So as an organisation, we really need to make sure that we're abiding with all of the key concepts really to make sure we're delivering quality care. And one of the key things is that, when you're going into a care call, please make sure that you've read the care plan prior to going in. And I know all of you do. I'll try your best to read as comprehensively as possible, but if there are any questions or any areas which you think aren't complete or not comprehensive enough, please just phone the office and get the update, because we want you to be as kind of aware as possible when you're going into someone's house. And if there is something that you believe is not being reported or it's not on the care plan, just report back, because we can always do a review. It's really important. Again, that the Pass app is as much a tool to monitor the care, but also to protect yourselves. So please make sure you're constantly using that, and also continue to log in and log out as appropriate. I haven't been sending out the leaderboards lately, but we are monitoring behind the scenes, and I'm glad to say they've really improved. But if they do start dropping again, we're going to have to start that process again. But I'm really happy how everyone's worked really hard to turn that around. So thanks a lot with that. A few things as well. I sent an email out yesterday in regards to the wellbeing services. So have a look at them posters, and it'll give you the codes to access. So now you'll have access to the 24-hour GP helpline. And just to explain, that isn't like a phone call you're just making. There'll be a GP there saying, here you go. It'll be to make an appointment, but you'll get a private appointment like ASAP. This doctor will be able to do, prescriptions and, certain assessments and things like that. There's obviously certain things they can't do because it's online, but there's a lot of things they can do, and it'll save you waiting in walk-in centres, trying to fight for appointments in your doctors, or even go to A&E unnecessarily. And I think your kids can use it as well, if they need to do as well. If you just have a look on the terms and conditions of it, it'll tell you. Also, there's helplines in terms of counselling, mental health support booklets and workshops. Again, on the wellbeing surveys, a lot of people asked about mental health support, mental health training. So these guides and things will be able to support people on that and provide, instant really support when needed. There's also a guide on finances, legal problems for any legal advice. And again, it's all, we're paying for it all for you. So it's there to access it. So please, use it. Alongside that, I sent out the email about the Whitechapel event tomorrow. So there's a number of people in the team and their little ones who are going along to Liverpool Cathedral tomorrow, doing an overnight sleepover, all in aid of the Whitechapel Centre. So you see some stuff on our Facebook and an email sent out. It's been quite last minute because we only found out about it quite late. But if people want to join on, there's a link on the on our Facebook where you can join on. You can pay a fiver. It's pretty much like a family, like a kids type event. But, feel free to join on. If not, please just give a sponsor, give £1, give £2. All of it's going to the Whitechapel Centre supporting the homeless across the city. And as you may know or may not know, Caring Connections does a lot of work with the Whitechapel Centre in supporting Liverpool's homeless population. The fantastic work of Brian Nolan and his team, working all the hostels across the city, and work in all the discharge lounges supporting hospital discharge for people who are homeless. So it's a real partnership we've got with them, and a real niche in our care delivery and supporting Liverpool's homeless. So please, get involved. And again, if anyone has any ideas and doing any activities, fundraising or events, Tough Mudders or, bake-offs or whatever, we're open to any ideas. So please put them forward. Let's have a look what's on the list. Yeah, so again, just a big thank you. Make sure to keep doing your ECMs, keep logging in, logging out, reporting any issues to your managers if you find any. And also, if you want to do a qualification, just let us know as we can get you registered. We really want to get more people now engaged on the qualifications, doing the level 2s, level 3s, and really moving people through the workforce. You'll see over 90%, probably more, people within the workforce who are in any leadership positions have all progressed through the workforce. If you look at Rachel, Katie, Claire Mellon, Julie, and they've all progressed through our workforce, and you can too if you want. So please just get on to us and we can help you get that journey started. So yeah, so massive thanks, people. I think that's all for this week. Just keep up the good work and yeah, keep on going. But make sure to take advantage of that new wellbeing scheme.